Good morning. Welcome to our commission meeting. Today is March 13th, 2025. We are in person and virtual today at the Washington State Liquor and Cannabis Board at 9:31 a.m. Better manage our meeting. If you wish to provide public comment, please raise your hand to be recognized. Once recognized, please state your name. Okay. Written comments on today's agenda items should have been received by close of business yesterday, March 12th, 2025. If you have technical difficulties, please email us at askus@wsgc.law.gov. I will go ahead and call the roll. Vice Chair Lawson. Here. Good morning. All right, Commissioner Ibsen.
Here.
Commissioner Charles.
Here.
Senator Conway. Senator Holy.
Here.
Representative Klova.
Here.
And Representative Waters. All right, well, we have a quorum. We will go ahead and get started. First is the consent agenda, which includes the February 20th meeting minutes, new licenses, and Class 3 gaming employees and house bank card room lists. Do we have any comments from commissioners? Any public comment? Hearing none, do we have a motion?
I move to approve the consent agenda as presented by staff. Seconded.
Okay, it's been moved and seconded. All those in favor say aye.
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 All those. Okay, motion passes. Next up, we have the director's reports.
Good morning, commissioners and ex officios. So just wanted to let you know that, happy to let you know that the agency received the 2024 Secretary of State's Productivity Award for Outstanding Small Agency based on staff's innovative cost savings ideas and suggestions, which related to electronic vehicles. And just a little information about the Productivity Board, which is part of the Secretary of State's office. They encourage state employees to help save taxpayer money by getting employees proposals to increase government efficiency. And so very happy to know that staff are thinking of innovative ways for efficiencies within state government. And then this is Problem Gambling Awareness Month, and so we do have some presentations later in the meeting, but just wanted to point out that we did partner with the Healthcare Authority and the Lottery Commission in issuing a joint press release to bring awareness to the state problem gambling program, which we'll hear later more about that program. We also had a disordered gambling advisory work group meeting this week, and so I just wanted to give you an update on that, but for just a reminder about what and how this work group came about. In 2023 legislative session, Senate Bill 5634 was passed that authorizes the Healthcare Authority to establish and facilitate an ongoing advisory committee. And that committee then is to hold quarterly meetings, and their focus is to track the progress of the recommendations by the Problem Gambling Task Force that was set out legislatively in 2019. And that task force then issued their findings and recommendations to the legislature in 2022. And so really to track the progress and make sure that that continues to be moving forward. And also to provide advice and feedback on the state gambling program, problem gambling program, and to discuss emerging issues related to problem gambling. And the Gambling Commission is a required member of the work group as outlined in the statute. So at this spring 2025 work group meeting, discussion included hearing from the Healthcare Authority as to the progress that they have made in recruiting and training more certified gambling counselors in the state. Because the task force findings indicated that there were some underserved areas in Washington. And so they're making great strides and efforts in making it easier for certified gambling counselors to get the training that they need for those certifications. And if I recall correctly, I think Evergreen Council on Problem Gambling is also very closely aligned with working to facilitate and make sure that we're trying to get more certified counselors in the state. Also, the State Problem Gambling Program is increasing awareness, outreach, and prevention. And one way that they're doing that is by exploring apps to deploy and really reaching out to the youth in colleges and really communicating, trying to focus more on the youth areas. So any questions on that? That is all I'm going to read today. Thank you.
Any other commissioners have questions at all?
I'll save mine for the presentations. Thank you.
All right, perfect. Next up, we have the 2025 legislative update with Tricia, Legislative and Rules Manager. Good morning.
Good morning, Commissioners and ex officios. Tricia Gullion, Legislative and Rules Manager. Today is the 60th day of this year's 105-day legislative session. Yesterday was the House of Origin cutoff, meaning all bills that do not have fiscal impact needed to be out of their chamber of origin. So House bills need to be on their way to the Senate, and Senate bills now need to be on their way to the House. Our agency request legislation is one of those bills that is still moving. House Bill 1222 regarding a public records exemption will be heard in the Senate State Government, Tribal Relations, and Elections Committee tomorrow morning. Additionally, our agency support legislation, House Bill 1149, which increases the penalties for animal cruelty and animal fighting, will be heard later this morning in the Senate Law and Justice Committee. And we will keep you updated as these bills continue to move through the process. Additionally, we are looking at the economic forecast, which will be released next week, which will kind of give a more accurate picture of the budget outlook that legislators will be looking at as they craft their budgets. We anticipate that after the release of the economic forecast, budget leaders in both the House and the Senate will release their proposals on what the next 2 years will look like. And we will also keep you updated on information pertaining to our agency as it comes. So that's all I got. Thank you.
All right, thank you. So the next item we have is tab 3, which is a compact amendment with the Nooksack Indian Tribe. However, I don't believe everyone's going to be here until about 10 a.m. So we're going to have to take a bit of a break of 15 minutes, and then we'll come back and get everybody set up for that. Thank you. All right, good morning. We are back from our break, and we're going to go into the Nooksack Indian Tribe Compact Amendment. I'm going to call roll again first. So Vice Chair Commissioner Lawson. Sorry. Here. Commissioner Ibsen.
Here.
Commissioner Charles.
Here.
Senator Conway. Senator Holy.
Here.
Representative Koba. Here. Representative Waters. All right, so we have a quorum, so we can go ahead and get started. So we have the
Vice Chair Leclerc is not online yet.
oh, okay. We are
Excuse me, Tribal Chair Rosemary.
all right. We are
Rosemary Leclerc, excuse me.
we're waiting for the Honorable Rosemary Leclerc from the Nooksack Indian Tribe, so it might just be a minute before she's able to.
She's not on.
Rosemary.
She's not on.
She just arrived and I gave her mics and camera.
Can you please give Johnny Ray access rights?
Johnny is on mute, but should be able to present.
So, okay.
I believe Chair Leclerc has her hand up.
Okay, Chair Leclerc, do you have your hand up there? I see, are you letting us know you're here? And I think we're ready to get started.
Okay.
Good morning.
There she is.
Good morning.
It's good to see everyone this morning. Thank you for allowing me to join, and I look forward to our short time together.
Very good. Thank you. So I think we're all here, and Chair, may we begin?
Yes.
Thank you. So we're here to go over the Nooksack Indian Tribe Compact Amendment. I would like to thank Chair Leclerc for the work that she and her staff did with the state during this negotiation process. We do appreciate a longstanding good working relationship with the Nooksack tribe, so thank you for that. And we'll just go ahead and dive in. So the Indian Gaming Regulatory Act provides the framework in which tribes in the state can negotiate Class 3 gaming activities on tribal lands as permitted by the state and when conducted in conformance with the tribal state compacts. Next slide, please. IGRA also outlines the topics that can be negotiated, which are outlined here. Tribal gaming provides tribal governments with the funds they use to build and sustain the governmental infrastructure for the tribe. Both the tribe and the state, if we can go to the next slide, please. Both the tribe and the state have shared interest in protecting the public from criminal activity and ensuring that gambling is legal and honest. And kind of going through these slides rather quickly. Pretty much all information that we've shared in the past. And then with the next slide, we have reached tentative agreement with the Nooksack tribe, the details of which the Johnny Bray will be going over with you after Chair Leclerc shares. But right now where we're at on this compact approval process is the RCW requires that the legislative committees hold hearings on the compacts and then action to be taken by the commissioners and ex officios within 45 days after reaching tentative agreement. Public comment has been open during this 45-day period. We have received no public comment via email or online prior to this meeting. And as of this morning, and then you will be taking public comment during this public hearing today. And the commissioners and ex officios will vote then during this, at the conclusion of this public hearing, on whether to send this compact to the governor for his review and possible approval, or to send back to myself for further negotiation with the tribe. So any questions for me as to the process and what has brought us to this negotiation before turning over to Chair Leclerc to hear about the impacts this will bring to the Nooksack tribe. Okay, thank you. Chair Leclerc.
Aiswayel, good day, good morning. Walasoit Telsqui, Talitzolqua Nooksack. I speak to you in one of my native languages, Hokomelem. My ancestral name is Iamnital. My English name is Rosemary Leclerc, and I serve my people as the chairwoman of the Nooksack Indian Tribe. It's a great honor to represent each and every tribal member this way. I want to thank the Gambling Commission for your time this morning to hear what's going on in Nooksack. Nooksack has one of the oldest compacts with the state. I believe we're second You see here, we have our reservation located in the Deming area, which is just east of Bellingham. And our casino is the Northwood Casino, which is located in Linden. Next slide. On this slide, you may see our tribal council. I've actually just stepped out of a meeting to be with you guys. So these are the leaders that represent us today. Next slide. Here's just the front view of our Northwood Casino. We're quite small, but we are what is it called? Oh my gosh, more coffee. But the games that we have are slot machines and table games. And yeah, next slide. This slide you see our dining area. Just a few inside pictures if you haven't gotten a chance to come visit us. We're nestled right up there by the Canadian border. Next slide. So here's a summary of the compact changes. Before we go into that, I guess I would like to talk a little bit more about the tribe in general. Our membership base is about 2,000 tribal members, and because of our unique location and the invisible line that came after, we do have members that are dual citizens of Canada. And the services that we provide our tribal members, a lot of the services are funded through the revenues of our enterprises. The casino is our largest enterprise. So to the summary of compact changes, we would like electronic table game appendix, sports wagering appendix, age limitation to be brought down from age 21 to age 18 years. Amendments, duration, and effective date, other changes to carry above amendments into effect. And I believe this is where I turn it back over to Julie.
Actually, this time it will be me, Johnny Bray. Good morning. My name is Johnny Bray. I work at the Gambling Commission with Julie. I am the Tribal Relations Advisor, and I have been in this role for about 18 months. And just to reiterate what Chair Leclerc mentioned, the Nooksack Indian Tribe's original compact was signed in October of 1991, and as she indicated, it is the second oldest compact, so it was after IGRA took effect in 1988. Their ETG appendix is similar to the one that was presented here in October of 2024 for the Stillaguamish tribe, which became effective when it was published January 15th of 2025. The tribe will be the 11th to add the electronic table games to its compact. Additionally, the sports wagering appendix is going to be added with this compact. The appendix is similar to several tribes that were approved in 2021. It includes responsible gambling provisions that have been updated consistent with those in the ETG appendix. The tribe will be the 21st to add sports wagering to its compact. If you want to direct yourself to our website, you can see the other 21 tribes that have added the sports wagering compact or sports wagering appendix as well. The age limitation, the tribe wants to update its age limitation provision to be consistent with what other tribes in the state have already done. This one is actually kind of old. Most of the tribes have changed theirs up to 20 or to 18 already. There are some other things, the other changes to carry above amendments into effect is just some of the technicalities to make these things work. Next slide. So as Tina mentioned earlier, we have had this out for public comment and we have not received any. So what we're at this point, we're just hoping that that you all can make the decision whether this should be forwarded to the governor or whether it should be returned for further action with Director Griffin. You have any questions?
Great, thank you. Do any of the commissioners have any questions?
I have one. Senator Conway here. What about your contributions? Do you have any obviously we've taken a lot of contributions out of our compacts, but do you have other contributions that you're making to local governments? This is for the chair. Hello. Are you aware of those that you make for police, fire protection, that sort of thing?
I believe we contribute to the fire department.
Okay.
I would have to follow up with that.
Do you do that on an intergovernmental agreement?
Not that I know.
Yeah.
Okay. Okay, very good. That was my question. Thank you.
Thank you. Any other questions from commissioners or ex officios? No? All right. Is there any public comments? Okay. Not seeing any. Do we have a motion?
I move we forward the proposed compact amendment for the Nooksack Indian Tribe to the governor for review and final execution.
Second.
It's been moved and seconded. Do we have any further discussion? All right, then I will have Director Griffin do a roll call vote for us. Please.
Chair Lawson,
Yay.
Commissioner Ibsen,
Aye.
Commissioner Charles,
Yay.
Senator Conway,
Aye.
Senator Holy,
Aye.
Representative Kloba,
Aye.
Representative Waters, and Chair Levy.
Aye. All right. Well, thank you very much, Chairwoman. Appreciate you being here. Congratulations. And also thank you to all of our ex officios. I know it's a busy time of year and I'm glad you could come make it here. It's important work that we do. And so with that, we will move on to tab 4, the problem gambling awareness with Roxanne Waldron and Shauna Russell.
Thank you all.
Waiting for our slide.
Okay. Right.
Good morning. I want to thank you, Chair, Vice Chair, Commissioners, and ex officios for the opportunity to present today. I'm Roxanne Waldron, for the record, and I'm the State Problem Gambling Program Administrator at the Division of Behavioral Health and Recovery at the Healthcare Authority. And I just want to state early on that the program is neutral on gambling. We provide services to individuals and their loved ones who are negatively impacted by problem gambling. And I know that the Evergreen Council on Problem Gambling after me is going to talk a bit about what they have been doing for Problem Gambling Awareness Month. And so I'm going to share a little bit about what our program is doing, and then a few updates about the work that's going on in the state problem gambling program, as well as what we do. And a lot of this work, I just want to say, is the result of hard work from many of the folks that are here, from many partners, including current and past commissioners and ex officios and staff. So I want to acknowledge that, especially in the past 5 years. So next slide, please. So before we talk about Problem Gambling Awareness Month, I'd like to share that we've hired a Problem Gambling Prevention Coordinator, Jeremy Whitaker, who is here. And one of his missions is to expand HCA's Problem Gambling Prevention outreach and awareness messaging from 1 month a year, really from Problem Gambling Awareness Month to the entire year, year round. We know that gambling goes on all year, not just 1 month. And so this is an example of social media messaging that went out about the Super Bowl this year. And we'll be working toward messaging throughout the year, especially during potential high betting seasons or times like the start of the NFL season and so forth. All right, next slide, please. So for Problem Gambling Awareness Month, HCA, Healthcare Authority, shared both social media posts and information on our HCA landing webpage that anyone can visit at hca.wa.gov, as well as on our internal HCA intranet for our employees. We also boosted and shared social media posts by the Evergreen Council on Problem Gambling and the National Council on Problem Gambling. Next slide, please. And for the first time, I believe it's the first time, the Gambling Commission, the Lottery, and the Healthcare Authority released a joint press release, which Director Griffin had mentioned earlier. And again, you can see that on our hca.wa.gov website. And there is a click that you can click there to go to a link. You can actually read the press release. And we also created a Smart Health activity for problem gambling. If you're a state employee, you may be familiar with Smart Health. It's available for all Washington state employees as a way to earn points toward having a slight reduction in your healthcare cost during the year. And so it's a big incentive for people to learn about specific topics. So that'll be up till the end of April. Next slide, please. All right, I'm going to give very, very few facts, but there's a lot more to know, and I'm happy to come back and talk about it in great detail, as all know. I'm going to share a few facts about gambling and problem gambling in Washington State. This is based on our 2021 survey, which is the last one that we did. It was a Washington State adult problem gambling prevalence study, and we plan to repeat it in the 2027-2029 biennium. So a lot of things have changed since then. This had to be administered due to funding during COVID, which was not the original plan. So we know that fewer people gambled, but we were able to look at the percentage of people that did gamble. And what we found that was that 4/5 of folks who gambled, 80%, were never going to experience a problem. They don't have any indicators of having a problem with problem gambling. So most people are able to gamble without any negative impacts recreationally, no problem. Then there was the 16.5% of the remaining 20% that were at an increased risk. The risk was not zero. They might have one or more indicators. Many of those folks will never develop a problem. A few most likely will. And then there is the 3.5% that's remaining of that 100% that were at a moderate to severe risk for problem gambling or even gambling disorder. And that number is estimated to be around 90,000 adults in Washington State. Again, we had fewer people gambling in 2021, so likely that number is probably larger now since more people are back to gambling. For the 16.5% that were in that kind of gray area, we were estimating about 420,000 adults. Again, that could be more now. So we want to make sure that when we're targeting our prevention, awareness, and early intervention messaging, we are looking at the folks that might be in that gray area, as well as offering treatment to those that are, seeking treatment for problem gambling or gambling disorder. All right, let's see. So a couple things we found was that when we asked about adults, if they were gambling online, we found that 11% reported of those that were gambling, reported gambling online, despite that online gambling is illegal in Washington State. And the more ways that adults gambled, the higher their risk was for problem gambling. So if they were doing one activity, buying a lottery ticket every week for a year, that's just one activity. The risk was very low. It tended to be around 1%. If they were gambling in 4 different ways, for example, maybe doing lottery tickets, online, they might be online gambling, whether it's legal or not. You can unfortunately access it without too much difficulty. And then going to a card room or a casino, that increases the risk. So if they were having 4 or more activities that they were doing, that increased their risk from 1% up to 13%. So it's just something to be aware of. Youth and young adults who gamble are at double the risk for problem gambling than adults in general. Adults in general have a 3 to 4% of those who gamble, and ours fell right in there, the 3.5%. Well, really 2 to 4%, but ours was on the higher end in 2021, that are at a risk for moderate to severe problem gambling. For youth and young adults, it's double that, between 6 and 8%. And that is a big focus for the state problem gambling program right now. So that's a lot of the work that Jeremy Whitaker will be doing and is doing already. He's really jumped in. We are focusing on youth and young adults with our internal prevention program at the Healthcare Authority for problem gambling. And then in the Healthy Youth Survey in 2023, which is administered throughout Washington State, 10% of 10th graders reported having gambled in the past year. We did give them a little clue as to what we meant by gambling. It could be online, it could be this, it could be that. And we found that 10% had said they had gambled. Again, that is, online gambling is illegal, which we assume much of that might be. We're going to be adding a question to the next survey that comes out this year to say, well, what is it that you're doing online when you're gambling or gaming? So we can get a sense of what those activities actually are. Some fall into a gray area, but between gaming and gambling, where youth and really anyone might not necessarily know that what they're doing is gambling. An example of that would be loot boxes, where you're purchasing something, but you don't know what you're getting. So you might be wagering your money to get a prize, but the outcome is beyond your control. So from the problem gambling point of view, that is that could be considered an aspect of gambling. And so for youth, it's particularly important that they understand what that looks like, and that is a big part of the efforts that we'll be working on. The other thing is gambling under age 18 is illegal. So we know that the longer you can wait to gamble till you're legal, the less likely you are to develop a problem later in life. If you have been gambling from an earlier age, underage, that is a known risk factor for developing a gambling problem. All right, next slide, please. So if people want to seek treatment, how would they do that? Well, there are a few options. They could go through their private insurance. Some insurances do cover that. They could pay out of pocket, which some people can do, some cannot. Tribal behavioral health agencies, many tribal behavioral health agencies have problem gambling treatment programs that are wrapped in with other treatment that they are doing, and most accept will serve both tribal and non-tribal community members. So that's often a resource that community members may not be aware of in their area. The Therapy Fund Foundation is a new group, a new organization that started up. It is private, and it makes funding available for African American and other people of color. Treatment is free. And we do have several of our certified gambling counselors in training who are also listed with the Therapy Fund Foundation. So people can access free care that way. Medicaid now covers problem gambling as of last January, a year ago. And again, we'll have to see what happens with Medicaid, but I'm feeling optimistic since it's only a small part. Perhaps it will remain, I hope. It will continue to be covered. We probably will have served in 2024, I have to check the numbers, but my guess is between 75 and 100 people. So it's starting out small, but as the number of certified gambling counselors grows, we will have more people that can access services under Medicaid as well. So for individuals who don't have coverage those ways, or they can't completely cover their costs, our program at the state provides free assessment and treatment for problem gambling and gambling disorder. And we have contracts with about a dozen problem gambling providers, either sole providers or behavioral health agencies, excuse me, to receive reimbursement for outpatient problem gambling services. And we are also working with the Evergreen Council on Problem Gambling. They're doing a lot of the heavy lifting. Actually, I want to give a lot of credit to them to recruit more clinicians who are in areas of the state. I believe you mentioned that, Director Griffin, in your introduction earlier. We know that there's a number of areas of the state that are either rural areas or that don't have enough certified gambling counselors. And so Evergreen is working to recruit more into training. We're also doing enhanced scholarships that will allow folks that are in these remote areas to have most of their costs covered for training. So that would be lowering the barriers for our behavioral health agencies and people coming in for training. Then telehealth is also an option for treatment reimbursement now since COVID, which is awesome, because if you have people in another part of the state but they're willing to do telehealth, then we don't have that problem of not having enough clinicians in that area. We are also looking at recruiting more clinicians that speak other languages other than English. We've had several new certified gambling counselors brought on or in training that are speak Spanish and other languages as well, which is awesome. We also need folks that speak, Tagalog, Vietnamese, Russian, Arabic, Thai, etc. And so we are working on that. It takes a while to get a certified gambling counselor trained. Usually 1 to 2 years, sometimes a little more. And so we are in that, we have folks that are coming into that pipeline, and that's something Evergreen Council is really working with us closely on that. Finally, inpatient residential. I just want to mention that we do not have any inpatient or residential treatment for problem gambling or gambling disorder in Washington State. There are several well-known programs that are in other states, including in Oregon. Bridgeways is one. The Evergreen Council on Problem Gambling does have contracts with several. They have limited funding and have been great about stepping into that void over the years. We would like to have that be something that our program could pay for. And we are looking at that, but we don't currently have a residential treatment in Washington State. Hopefully we will have one soon. Whether they will want to contract at the rates we can pay will remain to be seen. But I'm hoping that we can at least perhaps in the future fund out of state as well. So thank you, Evergreen, for that. We also have a list of agencies that we contract with for problem gambling treatment. It's on our website. If you look at HCA and problem gambling in your browser, you will find our page. And so clinicians can, refer people, but also people can self-refer, and they can also reach out directly to state program, or they can go through the Evergreen Council on Problem Gambling. We have a no wrong door policy between us. We help equally. And also people can arrange for their own assessments with providers. Next slide, please. So I want to talk a little bit about who is eligible for treatment. So we have a low barrier program, and individuals who are assessed as needing treatment and are amenable to treatment but are uninsured or underinsured for problem gambling treatment can come for free and receive treatment. There is no limit to the number of sessions. We ask that if someone is doing well and staying with a clinician and wants to continue, that every 2 years they get reassessed to make sure that is the appropriate. But we don't want to get folks to the point where they're doing well and then say, well, that's it, go forth. I think maintenance is really important for recovery, and so we do have that program available for anyone. As long as the client is amenable to treatment, tests out that they assessed as needing treatment and would benefit from treatment, then they are eligible. And then loved ones can also go through the program. So if someone's struggling with a loved one who doesn't want to go through treatment or assessment, they can do that without going through assessment and get support. It's not for Medicaid eligible folks. As I mentioned, they would go through the Medicaid side through their managed care organizations. But if they get denied for some reason or they have a hassle around that, we certainly will cover them. We always have covered them. We will continue to cover folks that, are not able to get their coverage through Medicaid. So to access treatment, people usually call the Problem Gambling Helpline, and which will help connect people to treatment in their area. That is maintained and funded by the Evergreen Council on Problem Gambling. And then so those who are seeking free treatment can come to our website, find out who we have contracted with. We don't contract with all the certified gambling counselors. Some counselors don't want to go through a 38-page contract. We would love to have them. We'll work on them. But we have about, as I said, about 12 providers at this point. Okay, next slide, please. Okay, so in response to the Problem Gambling Task Force's final recommendation report, which I think that Director Griffin mentioned, that was delivered to the legislature in December of 2022. There were 2 companion bills that were introduced in that spring legislative session by Senator Conway and Representative Stearns, and they had support from Representative Clova and others. And so the Senate version moved and passed and was signed into law by the governor, took effect on July 1st, 2023. What that did was increase our funding for our program over two years. So now when we're starting the 2025-2027 biennium, we are coming in with full funding for this next biennium. Really exciting to be expanding on our work. So the bill basically, increased funding, required that HCA create the year-round problem gambling prevention program. We also started, it wasn't required, but we did start a problem gambling prevention work group. And that group is going to be meeting through June. And that group is essentially meeting to help craft and give feedback on a state problem gambling prevention plan that will then be incorporated into a statewide prevention plan in 2027. So we're in the stepwise. So we're in that part of working with our other partners. And then there's also another committee, which you had mentioned, the Disordered Gambling Advisory Work Group, or the DGOF, with HCA as the lead agency. That's an ongoing and continuous group. And so in this last meeting we had on Tuesday, we went through all the things that have already been completed, the things that were in progress, the things we have yet to tackle. That yet to tackle is getting much smaller. So that's really exciting. Some of the in-process things will take a while, but it's super exciting to see that work happening. And then in addition to the changes from the legislative bill, we also got that approval for Medicaid to cover problem gambling. So now I'm going to share a little bit about the expansion of problem gambling services and prevention services. So next slide, please. Great. Okay, so we did talk about it being integrated year-round. We're meeting in that work group through June. Then we'll have a working version of a state problem gambling plan, which we are also, Jeremy's working hard in making that part of that of our work around that will be figuring out what our problem gambling program is going to be doing specifically, so how we will implement it. And then we are also working really closely with our other prevention colleagues at HCA, which is kind of a new thing and very exciting. And we probably will be doing a funding effort for community-based organizations that will help them integrate problem gambling into what they're doing with youth and in their community for the other topics that they're already covering, like substance use disorder and other things that are going on. Also mental health. And so that way it's not a heavy lift for them. So that's what we're hoping. So we're going to run a pilot program of that probably next year. And so we'll be able to report out on how that is going. And then we're also continuing our focus on populations that are at increased risk. These would be populations that are historically underserved, or we know are underserved, including communities that speak languages other than English, as we mentioned. We know there are some communities that are at increased risk due to socioeconomic status and the social determinants of health. And so we're focusing in on that. Evergreen Council, we're funding them to do a lot of that work as well. So next slide, which is the second to last slide, is on workforce development. And as I mentioned, another expanded focus is workforce development for certified gambling counselors. We did identify those areas, both the 11 geographic areas and the lack of clinicians who speak languages other than English, lack of problem gambling services within communities with populations at a higher risk. And then we also have a lack of clinicians that are from communities that are at higher risk who have lived experience. So we know that people often like to go and talk to counselors who have the same lived experience and come from the communities that they are being served in. And then finally, very excited to announce that training for the certified peer counselors, which is now actually a new WAC that just passed this last session, that increased the training for certified peer counselors from 40 to 80 hours. So these are people with lived experience, either themselves or their family members, loved ones. They can be certified. It's now considered a profession, and they now have to go through 2 weeks of training. And so because we had this opportunity, we were able to say, hey, since you're expanding your training, can we get in the door and have some information about problem gambling, gaming, internet use disorder? And so we were working with Tana to get some information added, maybe not as much as we would like, but future. We have goals. And then the other exciting part is that the Evergreen Council on Problem Gambling is creating an in-depth training for peers who want to go deeper. We would like to have some certified gambling peers in Washington State who are, certified peer counselors who understand problem gambling themselves very specifically, whether they've experienced it or not, because there are very specific kinds of things that are different. Many are the same, but many, there are some things that are different around being in recovery from problem gambling. So that, and then also our program is helping to fund scholarships for that, so it will be free for peers who want to take that training. It can often be difficult for people to find the funding, and we want to lower that barrier as much as possible, which we think free will do it. So last slide, please. Great. All right, this is me. I really appreciate the time to come and talk. And as I said, I'm happy to come back in the future or contact me. Loads of information if you're interested and not familiar with this. If my contact number, the helpline number, and also, reach out to me or to Tana or the Evergreen Council on Problem Gambling. So I think that's it. Thank you.
Thank you. Any commissioners have any questions for Roxanne?
Thank you, Ms. Waldron. Appreciate that presentation. It was excellent. And I'm sure, I could get this outside of this meeting, but I'm very interested in some of the demographics about like the problem gambling folks in particular. I just see it break down sometime in the future of that.
Yeah, I'd be happy to provide that. We do have that information. As I said, we'll also be remounting that study in a year or two. Are you talking about who's at risk?
Yeah, the actual populations at risk.
Yeah. So we do know that youth and young adults are at risk. We know that people that are doing online gambling are at an increased risk. They're actually at 3 times the increased risk. I'm not including in that sports wagering, legal sports wagering in tribal casinos, because that is geofence. That's different. But I'm talking about, the online gambling that in our state is illegal. That is an increased risk for problem gambling. We know that some populations of older adults, depending upon the specific demographics, are at a higher risk. We know that African Americans in our state are at a slightly increased risk for problem gambling. They may be at a more increased risk, but it's when you slice down those numbers really small, sometimes it's hard to say, you can see a trend, but it's hard to say that we can actually say with statistical significance that it's in that higher rate. But we do know that from other studies have shown that, Black, Indigenous, people of color, all at increased risk for problem gambling due to the social determinants of health, access to jobs, education, healthcare, schooling, clean environment. All of those things create impacts that put people at higher risk. Also, sometimes people live in areas where there's more likely to be gambling within cities. So some of that is what the environment is. So those are some of the areas that we know. There are military can be at increased risk depending on what kind of gambling you're talking about. It does break down a little differently depending upon the type of gambling. So, yeah. Think of any others?
Representative Koba, did you have a question?
Yes, I do, Madam Chair. And I think it's entirely possible that Ms. Waldron is not the right person to ask, but I'm going to give a stab at it, and perhaps you can direct me to the right person. But I really do appreciate all of the emphasis on year-round problem gambling prevention. I think that's so important, and I think those the social media messages and things look like they would be very effective. one of the tools, in addition to all of the fantastic treatment that you've been talking about, one of the tools that we can use is a self-exclusion program. And so we've got one up and running. Hope to, once the IT support is there, to be able to do it in a fashion that doesn't involve a stamp and the mail. But I was just wondering about the training that's involved for folks who are assisting customers with signing up for the self-exclusion, like when they are in the house bank card room, or other folks who are helping. Like one of the options is to go in person to the Gambling Commission offices and sign up for the self-exclusion program there. Do we have, or I'd like to understand a little bit better, what is the training that look like for that? Because I mean, I think there's subtleties about it and some sensitivities that need to be employed when dealing with folks with those problems. So I wonder if you could tell me a little bit, I guess, about the training.
Yeah, I think I'm going to refer you to Director Griffin and Tana Russell, who's going to follow me. I think they can answer that more clearly. I don't want, I want to give them an opportunity to give you facts instead of whatever I might say. So I'm going to open it. But thank you for the opportunity. Thank you for the question.
No, and thank you for the presentation. Very, very good to hear.
I think there are a few more questions. Oh, are there? I don't know if Director Griffin wanted to touch on that first.
Yeah, I can answer that question, Representative Kloba. So for the licensees, there is a requirement under the WAC that they go through annual training, I believe. And so that's set out, as I indicated, in WAC. And it is something that is a current topic that we're working with Evergreen Council in terms of submitting the documentation and engaging with our staff. When someone comes to self-exclude, we are working with Evergreen Council on Problem Gambling to develop a program, a training program for our staff that we hope to have memorialized through a video so that we can also have staff continue to refer to that and use it for new staff training as well. So certainly something that we are engaging with them actually last week. So hope to have that up and running in the next few months.
Oh, okay. Wow. Thank you. I appreciate that. I think the video sounds like a very useful tool. So thanks for that update.
Thank you. And then Commissioner Gibson.
Yeah.
Thank you, Chair, and thank you so much for your presentation. Kind of a shot in dark question, maybe more of a legislative or government relations question, but aside from the technological hurdle involved, I'm sure, is there any reason why self-exclusion could not be expanded to include online gambling?
I think the biggest hurdle is online gambling is not legal in the state. And so we don't have a mechanism in which to require the illegal operations to have a self-exclusion component. So I think that's my initial challenge with it.
Or the quasi-online gambling, I should say, like. Yeah, so you're kind of in that gray area.
We don't, if it's not authorized, it's not something that we could then, it would be a challenge then for us to impose requirements on something that's not legal in the state.
Certainly. Thank you.
I would say also that one of the recommendations that came out of the Problem Gambling Task Force report was to create a work group that looks at online gambling, online gaming, the intersection of gaming and gambling, and also internet use disorder, to look at those impacts on our state and to do some of that talking about what might be possible in the future. Again, we can't get in, ahead of what the legislators have determined.
Yeah, and I should clarify, Tina, apologies for the ambiguity. I didn't mean explicit gambling, but more like that. You mentioned loot boxes and gaming, for example, that sort of gray area not quite gambling, but sort of a gateway drug, if you will. Like if there's.
There was also a recommendation to look at consumer protections for youth around that exact kind of issue. There is a product called Gamban, which is out of the UK, but it does include thousands and thousands of websites that it will block. And that can be downloaded. It's not cheap, but it can be downloaded at any time by anyone. We have talked about trying to sponsor that through our program, but it's quite expensive. So we're still in the looking at it phase. And we also are looking at a couple of other apps that do different things, but that is one that anyone can download at any time. So if people, that can be a tool that clinicians or others can use, even if we don't have a formal process in our state to ban online gambling for a specific individual.
Yes, and thanks for clarifying, Commissioner Gibson. And then to your point, I think, as you indicated at the beginning of your question, I think that the opportunity would be at the legislature level,
yes,
potentially, maybe through something with that industry to have requirements on that industry. It's certain. Right now, it's not something that we could do anything with in terms of the Gambling Act, but potentially the AG's office has a consumer protection division, and that's where most of those sorts of things, we work closely with the consumer protection division and referrals when it might fall outside of the Gambling Act. And so I think that is certainly, as you indicated, a viable option to pursue that self-exclusion component for those activities.
And it just for shorthand purposes, is there a general catch-all term for that kind of not quite gambling, but effectively leading to gambling, whether it's an online gaming or social media or otherwise, just for the sake of avoiding word salad? Is there a shorthand term to refer to that?
Yeah, I think I'm going to let Tana answer that because she's the gamblification queen of our work, and she presents on this all the time. So I would like her to give you an answer. We still also struggle towards having a term,
sure,
which is why we had a whole was a glossary in our problem gambling task force report to say this is what we agree that this means. So I agree that's tricky, but I want to thank you all, commissioners and ex officios, for your questions. Appreciate that opportunity to respond. So I'll turn it over.
I have one last question for you. Sorry. Yeah, I'm really interested in the youth and young adults piece in particular, and I'm just wondering, like, if you could give any more insight or like understanding on like marketing strategy, like, or what you guys are thinking around education and marketing to those youth. Because anyway, yeah,
we would love to come back and report on that specifically. Maybe in the next 3 to 6 months, we could come and give a presentation very specifically on the prevention, because we're growing that right now. Jeremy Whitaker has been very involved with working with our prevention folks in-house to figure out what's the best way, because we know that for youth, you can't message necessarily the same way for teenagers as you can for adults. With adults, you can say, be very scared, be worried. For teens, you cannot. You need to promote, positive norms, other ways of doing that. So figuring out what messaging they're using now, what kind of messaging we want to do around that is what we're figuring out. I'm not a prevention specialist, so I'm learning as we go. Jeremy has a deeper background in that, but we have to learn the HCA way, and they already have campaigns going on and that are pretty effective. So, but I'd love to come back and share and then get feedback as well.
I love that. Thank you.
Yeah, thank you so much for your questions.
Thank you. Next, we have Tana Russell, the Deputy Director of the Evergreen Council on Problem Gambling.
Hi, my name is Tana Russell. I am the Deputy Director of the Evergreen Council, and I have been with the Council since 2019. And my background is as a counselor, first as a drug, alcohol, substance use disorder counselor, specializing in tobacco and then gambling. So I came to the Council from treatment world. And I will be talking a bit about our responsible gaming programs, so I may be able to give some more context around the questions earlier. If I don't, please feel free to interrupt me or ask me at the end and I can give more context. I don't know who has control of the slide. I should look at that. Okay, perfect. So we are a nonprofit. We are an affiliate of the National Council on Problem Gambling. Not every state has an affiliate, but many do. We focus on treatment support. We do not provide direct treatment services, but we do support the treatment programs that are in our state. We also specialize in providing training as well as outreach, awareness, prevention, etc. And we have owned and maintained the Washington State Problem Gambling Helpline for over 30 years, not quite 35 years. Next slide. So this is just an overview of kind of what I'm covering in this slide deck, so we can move on, and then if you reference it later, this gives you a bit of a table of contents. So in terms of the treatment support services, again, there's the helpline, and we provide the helpline with the directory of all certified gambling counselors and the trainees who have opted to be listed in the directory to the helpline, as well as on our website. And it provides a variety of information. So whether someone calls the helpline, texts, chats, or just Googles it, and it will direct them to our website, they can find information to get a provider. There's also, of course, other services in the state, including Gamblers Anonymous, Gam-Anon, websites, chat forums, other community groups, and things that they can access. Roxanne talked a bit already about outpatient and residential, but essentially anyone with a gambling disorder, often by the nature of the gambling disorder, is left unable to afford to pay for treatment. That's one of their biggest concerns. It's primarily covered by private insurance, Medicaid, tribal funding, and state funding. We do have some funding to help support that as well. Gambling disorder is a very deadly disease. We do not want people dying from this, and we do have funding to help that. Residential treatment funding, as Roxanne said, primarily covered by us, and some of the tribes have funding to send their clients to residential as well. Next slide. The support that we provide for counselors, we provide the administrative services for the Washington State Gambling Counselor Certification Committee, training for the counselors, support for them and their programs to get up and running or enhance their programs, the training scholarships that Roxanne mentioned, HCA funded, not just for treatment providers who want to become gambling counselors, but also peers, prevention specialists, students, educators, school counselors, etc., with some enhanced funding to really help those providers in geographic gap areas that primarily serve underserved populations or who themselves are underrepresented clinicians in the behavioral health sector. We also have, so before a counselor can get certified, they have to have their college education, and we have found that that is actually a big barrier. So we have student grants and awards to help support those who are getting their college education, juniors, seniors, freshmen, sophomore, junior, senior, master's and doctoral levels, with an emphasis on, of course, those specializing in gambling and gaming and those who are underrepresented in academic spheres. Next slide. We are one of the only councils that has not one conference a year, but two. And we have workshops in between. So the next conference coming up is our Focus on the Future conference in the spring. I've got the dates for that on the next slide, and then you also have the dates for the things coming up. Twice a year, we offer the Gambling Counselor Core training for those who want to enter the field. And you can go to the next slide. So here's the dates for our Focus on the Future conference. It is May 5th to 8th in Seattle. And you can go to the next slide. And we have a number of different speakers featured. If you've ever heard of motivational interviewing, it is a staple not only in counseling world, but also criminal justice settings and clinics across the country. And Dr. William Miller, who is one of the founders of that since the 90s, is speaking at this conference, as well as a number of other notable presenters and topics. And if you go to the next slide, I've pulled some of the training titles that I thought you all might be interested in should you get a chance to attend the conference. Things like video gaming based gambling, one of the things you guys were just asking about, gaming, caffeine, and sleep in youth, health risks of sports betting among young adults, primary prevention for young audiences, leveraging state resources for problem gambling support, which is where Jeremy and Roxanne will be presenting, cryptocurrencies, NFTs, etc. And next slide, please. So Focus on the Future has been going annually since 2008. Four Directions has been going annually since 2009. It was started in collaboration with tribes, and every year it is hosted by a tribe. And it is thanks to the Suquamish tribe this year, which will be hosting it in September at the very beautiful Clearwater. And next. So other trainings that we do are our responsible gaming training. I'm going to talk to you more about that on the next slide, but we also travel around, not just the state, but also the nation, doing presentations at state and national conferences. And if we'll go to the next one, our responsible gaming training we do for tribal casinos, card rooms, TGAs, the Gambling Commission New Agent Training, the Gaming Law Summit, etc. Our RG Star program, Responsible Gaming Support Training and Resources, is designed to provide a very holistic, evidence-based, as much as current data-driven as possible, training for the gaming industry to really build robust programs. It does cover self-exclusion, and it offers different training based on staff position as well. So manager supervisors, frontline training, new hire, all staff, etc. And what to do if they hear someone say something concerning about their gambling. So if you can go to the next slide, some of the content of the RG Star key messages is why responsible gaming is important, why it's good customer service, some signs and symptoms of problem gambling that they may see working in the industry. Of course, if they hear someone say something concerning about their gambling, how do they respond to that? Who do they get? And then what happens with that? What are the menu of options, both the self-exclusion program as an option, as well as community resources that they can provide to that person, and then let them choose what they want to do with that information. And of course, support for team members, right? As always, we want to be sure that the team members are supported should any of them be dealing with gambling-related harms. Next slide. And we did just complete a contract with the Gambling Commission to help develop some signage for the card rooms that provides the helpline, so that anybody who may be considering whether or not they want help can easily access it. We do provide training for the helpline call center. And what's interesting is I was just on a call with them a couple weeks ago, have another one coming up, and I was asking them about how they've seen things change over the years. This call center answers not only Washington State's helpline, but also the national helpline and many of the other states. So they've got the best picture of what's going on across the nation. And they said they're getting more calls from younger audiences, more calls about online gambling and sports betting, and more calls from people that they're not necessarily calling to get help. They're calling to find out, should I be worried about what's going on? They're just curious, and they just want to talk to somebody about, here's what I'm dealing with, should I be concerned or not? So just some interesting information on kind of the changes they've seen over the years. Next slide. So we offer youth-focused and prevention programs, the most recent of which is our Youth Have the Power program. The main landing page, which you see there, provides resources for parents and guardians, youth, and adults who work with youth. And then if you click one more time, it'll kind of show you those resources. It also provides a portal for youth if they want to, and they can just put in a nickname and a email. They can do it anonymously if they want to, where they can work through a curriculum to learn about gambling and gaming. A lot of people assume that if a young person, because they're 18, they can't gamble legally, therefore they aren't. But in fact, many of them are, but they wouldn't necessarily recognize that it's gambling, because it is, as someone mentioned earlier, loot boxes or other things within video games. So it gives them some education on that. They can also complete challenges which earn them points, and those points can be redeemed for awards. And there's nothing randomized about it. Here's your challenge, here's how many points, and here's the awards, and here's how many points. So it's like a job and store model. So it helps kind of teach a little bit of the financial management skills while encouraging them to do challenges, which might be things like interviewing their school counselor about their job or mental health. It could be interviewing their peers about mental health concerns. It could be, there's lots of culturally focused challenges, like talk to an older adult or an elder or someone about your culture or things that might help prevent future risks. So it's about enhancing protective factors by getting them engaged in more protective factors and connection with people and services in their community. Next slide. As Roxanne said, March is Problem Gambling Awareness Month. For us, it's basically just ramping up what we do all year. And every year has a different focus. This year, one of the focuses is on adults age 50 plus, and also we have a variety of messaging for all demographics. So there's a little bit of a sampler. And next. So one of the things that we do, which is kind of woven in everything that we do, is promoting equity and reducing barriers for all demographics. We are not anti-gambling or gaming, but we are for help being available for anyone and everyone who needs it, ideally in services that are culturally appropriate and in their language. So we have digital programs, a couple video series on our YouTube, Kaleidoscope, which is Kaleidoscope Reflections of Diverse Views on Mental Health Equity, ECPG Live, which is another video series, the Connections Healthy Gambling and Gaming podcast. We have a number of different community advisory committees, including actively running our Latinx Community Advisory Committee, Recovery Community Advisory Committee. We have also and will be revamping our AAPI Indigenous, and then starting Black community and military veterans this year. And these individuals are all volunteers who essentially just advise us on here's the gaps they're seeing in their community, here's where we need more resources, or here's messaging that would be more relatable for the people in our community. And of course, we do this with community partners. And next slide. This gives you just sort of an example of some of that, be it our Spanish language page, brochure, resources, all of which were informed by our Latinx Advisory Committee. We also have just gotten back a lot of material that was then translated into Japanese, Korean, Simplified and Traditional Chinese, Tagalog, and Vietnamese, which we're going to be using to produce also more materials, be it a website, brochures, etc. And I think that's it. Go to the last slide. Yeah, and there's my contact information. So what questions would you all have if you have any?
Thank you very much for that. Do any commissioners have questions or?
Thank you. An excellent presentation. Appreciate it. I just had a question about the gambling counselors and trainees and just like where the requirement for college degree comes from in that piece. Is it?
Yeah, that is actually stemming primarily from the Department of Health. So in order to be a licensed marriage and family therapist, mental health counselor, substance use disorder professional, etc., they all have various college requirements. For some, it's a 2-year or a master's. So in order to become a gambling counselor, they first have to have an active Department of Health counseling license that's in good standing.
Does that so I know the governor is trying to change the requirements for is that something that you guys have explored? Is that something we can maybe look into?
One of the things we have looked into is trying to get more problem gambling disorder education into those college programs. A lot of counselors seek out this training and this specialty credential because their college programs, and I can't speak for everyone in the country, some cover it to different degrees, but generally what they say is my program either didn't touch on gambling disorder, or if it did, it was kind of lumped into my general abnormal psych DSM-5 diagnoses, or they had a guest presenter who talked for an hour of a 4-year program. Right? So they're coming out of these programs, showing up at our training saying, I'm here because I'm seeing it and I feel unprepared to help the people that are coming into my office. So we're hoping to, and one of the things that we do is guest speak at a number of these different colleges and their counseling programs, where the professors kind of invite us in to cover that, but really we'd like to see something more sustainable and holistic, so that when counselors are going through these programs, they get enough training that when they encounter it in the real world in their practice, A, they're not surprised by it, and B, they know what to do. Whether it's, yes, I can adequately treat this, or I need to refer to a specialist.
Thank you.
Yeah.
You, any other questions? All right, not seeing any, so thank you very much. We appreciate that. You guys always provide us with such good information. All right, so that brings us towards the end of our meeting, so we will now take public comment. There is any?
We do have Tony.
Oh, I'm sorry. Did I skip somebody?
He has just a couple seconds. Thank you.
Oh, Tony Hughes, agent in charge. So sorry about that. I didn't even.
That's all right. I was just waiting to see where it went. I'm fine. It'll be brief. Good morning, commissioners, ex officio staff. My name is Tony Hughes. I'm the agent in charge of our regulation and enforcement unit. I'm just going to touch base a little bit of overlap with Tana's presentation on problem gambling signage, but next slide, please. I believe it was last summer, we update WAC 230-06068, problem gambling signage and posting requirements. The Gambling Commission provides our licensees with informational signs, and within the WAC, there's requirements for the signs to be conspicuously posted at certain areas of the business. And on my future slides, I'll be showing some of the same slides that you already saw, but so we're Evergreen Council Problem Gambling helped us with those slides, and we have printed 8,000 of those signs. So the signs are created. We printed 8,000. Our staff have been distributing those new signs at the start of this year as we are visiting our licensees, doing our proactive inspections, and those signs are also available on our public website to print on demand as well. And then part of our inspection program, that is one of the steps we do with our inspections, just to make sure that those signs are continuously there as we do our inspections on an annual basis. Next slide, please. Pretty much the next two slides are going to be this, the carryover from Tana's presentation. From my personal experience, obviously the graphics are different from previous signs. I'd see the updates that I've seen are obviously the QR codes, a text and chat feature, which Tana might be able to explain a little bit more, but those are new. So just another avenue for people to get the assistance they need. Obviously, the messaging. There's four different problem gambling signs. Take a break from the game. Know your risks. Next slide, please. And then don't borrow to gamble and stick to your limits. And then transitioning from problem gambling signs to the self-exclusion program. So next slide. The Gambling Commission, just a quick brief overview of our self-exclusion program. We do an annual report to the Commission. That's going to be coming up in July. But just a quick overview for it right now. It's our self-exclusion program started on May 1st, 2022, so it's approaching 3 years. The program applies to all house bank card rooms. If a person wants to exclude themselves, they select the term they want that's on our forms. They can select 1, 3, 5, or 10 years. Once they serve the term they selected, then they can remove themselves from that list. Since 2022, there's been over 1,000 people that have participated in that program. And that, next slide, and that was my brief presentation. I'll pause there.
Thank you. I do have one question. I think we can only really tell about the 1 year, it seems like, but have you noticed any people getting done with the 1 year and then re-signing up? Or
I'm aware, I don't know the exact number, but I'm aware of multiple people, or at least I know of an example. I'm not sure. I assume there probably may be more than one that a person has enrolled in a 1 year term, removed themselves, and then also re-enrolled again.
Okay, thank you. I was just
Yeah.
curious if people were getting off and.
Yep. No, that I'm aware of at least one example. There may be more.
All right, great. Thank you. I'm really sorry for the oversight there.
No,
Appreciate
no,
you
that's
being here.
that is fine.
All right. Does anybody else have any questions? All right.
Thank you.
Annie, thank you. Okay, so now we are coming towards the end of our meeting. Is there any public comments from anyone? Okay, I don't see any. The next Gambling Commission meeting will be held on April 10th and 11th here at the Liquor and Cannabis Board. The commission will now be going into executive session that's expected to, well, we'll take a 10-minute break. We'll start up at 11:20 and we'll expect to conclude at 1:20. The purpose of the executive session is to review the performance of a public employee. Thank you, everyone.
Good job. We are recording.
All right, we concluded the executive session at 12:35 p.m. and now we're in the open meeting for the purposes of concluding the March meeting. It is now 12:37 p.m. and we are adjourned. Thank you.